Hello and welcome. Let's talk about local anesthesia or regional anesthesia. So, what is it meant by local anesthesia? This is a method of anesthesia which is practiced to anesthetize a specific part of the body. Types. It may be topical anesthesia, no-block anesthesia, transversus abdominis, plain block anesthesia, IV regional anesthesia, spinal anesthesia or epidural anesthesia. Mechanism of action. It causes temporary conduction block of the nerve, thus preventing the propagation of nerve impulse. Indications. In minor surgery like drainage of abscess, dilatation of urethral stricture, excision of papilloma, laryngoscopy, bronchoscopy, endoscopy, dental extraction, etc. In case of surgery of arm and hand, surgery on toes and minor surgery of foot. Contraindications. In case of sepsis near the field of injection, where large amount of may be needed and there may be a risk of toxic reaction when the patient is non-cooperative. The prerequisites for doing a surgery under local anesthesia includes appropriately skilled personnel, resuscitation equipment, and oxygen should always be available. Advantages. It is technically simpler, general anesthesia is avoided, consciousness is retained, and patient can have food earlier after surgery. Disadvantages. Local infection or hematoma, systemic complications due to overdose or accidental. Intravascular injection. So why adrenaline is added to local anesthetic agents? The answer is the advantages of use of local anesthetic agents mixed with adrenaline is that adrenaline causes vasoconstriction. So if we mix adrenaline with local anesthetic agents with adrenaline, it should prolong the action of the local anesthetics by preventing absorption by blood vessels and prevent systemic toxicity of local anesthetics. Now, complications of local anesthetics. The CNS toxicity includes tingling of the tongue and lips, known as circumoral paresthesia, lightheadedness, auditory disturbances, slurred speech, muscle twitching, visual disturbances, unconsciousness, convulsion, and coma. The serious effect includes myocardial depression, cardiac arrhythmia, and ventricular arrest. Respiratory includes respiratory arrest. The signs and symptoms of local anesthetic toxicity includes circumoral paresthesia, depressed conscious level, lightheadedness, convulsions, and cardiac arrest. The management of local anesthetic toxicity includes oxygen inhalation, establishment of IV line, IV fluid administration, management of convulsion, and if cardiac arrest occurs, CPR and DC shock should be given. Now, epidural anesthesia. It is a form of regional anesthesia where anesthetic agent is applied in the epidural space. The procedure for epidural anesthesia is given here. Now, advantages. It can be used for continuous, repeated, prolonged anesthesia, for good muscle relaxation. It doesn't produce hypotension, and it can be used for postoperative analgesia, and it can be kept for several days. The disadvantages as well as complications include CSF leak and aseptic inflammation of the meninges causing headache, meningism, infection, nerve damage, spinal injuries, and epidural anesthesia is technically more difficult than spinal anesthesia with a higher failure rate. Now, end of the topic.